You don't need to be a scientist to detect cancer early. You just need to observe your body like a scientist. Cancer doesn't start suddenly, it gives early warning signs. For different cancers, there are different signs. And if you don't know those signs, how will you recognize them in time? Hi all, I'm Dr. PriyaRavi PhD. In this video, we will see what those early warning signs are and how they are linked to different types of cancers. But remember this, most of these symptoms are caused by simple treatable conditions and not necessarily always cancer. But when a symptom lasts for more than weeks, it's wise to get checked. Number one is thickening or lump in the breast or anywhere in the body. A lump can appear in places like breast, testicles, glands, lymph nodes of neck, armpit, and groin. And these are all related to breast cancer, testicular cancer, or lymphoma. But most lumps are non cancerous. They can be due to infection, cyst, or fibroids. However, any lump that persists for longer weeks should be checked. And number two is changes in bowel habits, like blood in the stool, which is usually dark or bright red in color. If there is long term constipation, diarrhea, or narrow stool size, then it can be associated with colorectal cancer. But also remember, they can also be due to piles, that is hemorrhoids, or diet changes, stress, or infections. Medicines and other medical conditions can also cause them. And number three is change in bladder function, like painful urination, blood in urine, frequent urination. These all can also indicate bladder cancer or prostate cancer. But usually they come from urinary tract infections, kidney stones, or prostate enlargement also. And the fourth is indigestion due to bloating, acid reflux, feeling of not eating, heaviness, and difficulty in swallowing. If this stays for more weeks, maybe there can be a sign of stomach, esophageal, or throat cancer. Yet in real life, indigestion is almost always due to acidity, gastritis, or reflux. And the fifth is unusual bleeding or discharge. For example, coughing up blood can be related to lung cancer, and blood in stool to colorectal cancer, and blood in urine to bladder or kidney cancer, and blood in nipple discharge to breast cancer, and abnormal vaginal bleeding to uterus or cervical cancer. And cancer of the womb or cervix can cause women to bleed between periods or after intercourse, and women who have any vaginal bleeding after they have had their menopause should immediately see their doctor. However, bleeding has many non serious causes like piles, infections, or hormonal changes. Still, persistent bleeding always needs medical attention. And the sixth is nagging cough or hoarseness that doesn't go away. So, long term cough may rarely indicate lung cancer, throat, larynx cancer, or thyroid cancer. But 95% of the time, it is due to allergies, viral infections, acid reflux, smoking irritation. If cough is persistent and associated with loss of weight and appetite, then it is advised to check with doctor. Seventh is severe or long lasting pain. So, depending on the location, it may be connected to bone, testicular, or brain tumor, ovarian or colorectal cancers. But we know that pain is one of the most common symptoms of everyday life and usually comes from simple causes like muscle strain, arthritis, migraines, and nerve compression as well. And the eighth is unexplained weight loss. So, when a person lost a lot of weight without trying, that is unexplained weight loss of more than 10% of their body weight over a short period of time, then it is occasionally linked with pancreatic cancer, stomach, esophageal, and lung cancers. But sudden weight loss often comes from hyperthyroidism, stress, anxiety, gut issues, and dietary changes as well. And the ninth is changes in a mole or skin patch or wart. So, changes in color, size, shape, or borders of the wart or mole or skin patch may indicate skin cancer. But many skin spots are benign, especially in sunny climates. And the tenth is sores that do not heal for more than 3 weeks. They can be related to skin cancer, oral, penile, vaginal cancers. But most source comes from vitamin deficiency, injury, diabetes, and infections as well. And the most important thing is Having one of these symptoms does not mean you have cancer. Many common, harmless conditions can also cause them. But if a symptom continues for more than 2 to 3 weeks, it's always wise to get it checked early because early awareness is equal to better prevention. If this video helped you, share it with someone who might benefit.